My name is Itamar Futterman. I am a maternal-fetal medicine attending. I am also the director of complex obstetrical surgery and the associate director of the maternal-fetal medicine fellowship here at Maimonides. The typical patient will see me for maternal diabetes, high blood pressure, fetal anomalies, etc. We've also created a pathway for patients to come in with known surgical morbidities, including placenta previa, placenta accreta, high BMI, multiple prior surgeries, and large fibroid uterus, because we want to make sure that these patients are going into their C-section, their scheduled C-section, in the safest possible way. I work with a wonderful team of laborists who are part of the complex obstetrical surgery team. We are the first responders to these cases. And of course, we collaborate with a very wide network of surgical support, including our gynecologist, our gynecologist-oncologist, our trauma surgeons, our interventionist radiologists. All of them are here in the hospital available to help. To me, a good doctor in maternal-fetal medicine means, first and foremost, that you care. You care about the patient that you're seeing. I think for us, 90% of our day is spent with patients who happen to come by the ultrasound unit. They're getting their ultrasound because they're pregnant, and they move on, and the outcome is good, and mom is healthy, and baby is healthy. But unfortunately, I think within maternal-fetal medicine specifically, we also see the more complicated, the more worrisome cases when it comes to pregnancy, both for mom and for the baby. To be a good doctor in maternal-fetal medicine, you really have to show those patients specifically that you're there for them, that they're not alone in this journey, that their high-risk pregnancy is going to be accompanied by someone who will be there for them, someone they can develop a relationship with, someone who will be there to answer their questions and make them feel safe. My philosophy when it comes to patient care is that you really want to keep the patient in the center. And I think by keeping it patient-centered, regardless of the challenges that may come up, gives them the reassurance that there is a physician who cares about them, who is there for them, and who is there to really show them or help guide them towards good decisions for themselves. I completed my medical school training and education at Ross University School of Medicine, and then I started my residency actually up in Buffalo for a year, where I was inspired by incredible OBGYN generalists who are providing phenomenal care to patients in that area. Soon after that, I transferred to another residency program here in New York City, to New York Medical College. What drew me to Maimonides initially, when I was interviewing for fellowships, was the opportunity to potentially carve out my own pathway during my time in training. And that's exactly what happened. I came in looking to do more research and was able to achieve multiple publications during my year in research. I think it's also unique to be in Brooklyn, where there is so much diversity in our patient population. It's great as a newer attending and someone who's in the beginning years of their medical career to be exposed to such wide diversity in patient population and patient pathology. All those factors together made it very clear to me very early on that I would want to be a part of this Maimonides team.